Lungs. 1. The right and left lungs are situated in the corresponding halves of the thorax within the pleural cavities. 2. Situated between the lungs are the organs of the mediastinum. 3. At the front, back, and sides, each lung adjoins the internal surface of the thoracic cavity. 4. Shape of the lung. Cone-shaped, flattened on one side, with a rounded apex. 5. The right lung is shorter and narrower than the left lung due to the higher location of the diaphragm's cupola. Surfaces of the lungs. Each lung has 3 surfaces. 1. Diaphragmatic surface concave and faces the diaphragm. 2. Costal surface convex and adjoins the inside of the thoracic cavity. 3. Medial, mediastinal, surface adjoins the mediastinum. Each lung has a base towards the diaphragmatic surface and an apex at the top. Margins, borders of the lungs. 1. Anterior border between the costal and medial surface. 2. Inferior border between the costal, medial, and diaphragmatic surfaces. 3. Posterior border between the costal and medial surfaces. 1. The left lung has a recession on the anterior margin called the cardiac notch, incisura cardiaca, which is limited at the bottom by the lingula pulmonaris. Right lung. 1. Apex. Located above the clavicle and the first rib. 2. Anterior margin. Extends from the apex to the right sternoclavicular joint. Passes to the middle of the sternal angle. Extends down behind the sternum to the level of the fourth rib cartilage. 3. Inferior margin. Begins at the anterior margin and extends as follows. Midclavicular line, at the 6th rib cartilage. Anterior axillary line, at the 7th rib. Posterior axillary line, at the 9th rib. Subscapular line, at the 10th rib. Paravertebral line, at the neck of the first rib. 4. Posterior margin. Extends up to the head of the second rib. Left lung. 1. Apex. Located above the clavicle. 2. Anterior margin. Begins at the left sternoclavicular joint. Extends behind the sternum down to the fourth rib cartilage. Continues along the lower edge of the fourth rib cartilage until the peristernal line. From there, it extends to the 6th rib cartilage before turning. 3. Inferior margin. Starts at the end of the anterior margin. Positioned half a rib lower than the right lung. Continues onto the posterior margin along the paravertebral line. 4. Posterior margin. Passes upward along the vertebral column. The posterior margins of both lungs are approximately the same. Lobes and fissures. 1. Right lung. 3 lobes, superior, middle, and inferior. 2. Left lung. 2 lobes, superior and inferior. 3. Oblique fissure, present in both lungs. Extends from the posterior margin, below the apex, to the anterior margin, at the level of the 6th costal cartilage. Separates the inferior lobe from the superior lobe, right lung, also from the middle lobe. 4. Horizontal fissure, only in the right lung. Begins on the costal surface at the midpoint of the oblique fissure. Separates the superior and middle lobes. The middle lobe can be seen from the front and medial sides. Hilum and bronchial tree. 1. Hilum. The medial surface of each lung, containing the root of the lung, formed by vessels, nerves, and the main bronchus. 2. The hilum in the right lung is shorter and wider than the left hilum. 3. The main bronchus divides into lobar, secondary, bronchi, right lung, 3 lobar bronchi. Left lung, 2 lobar bronchi. 4. The segmental, tertiary, bronchi divide into subsegmental bronchi, right-pointing arrow, lobular bronchi, right-pointing arrow, interlobular bronchi. 5. In the right lung, the superior lobe bronchus is above the artery, epiarterial, while in other instances, the bronchi are below the artery, hypoarterial. Bronchial tree structure. 1. Bronchi walls consist of 1. Mucosa. Contains goblet cells. 2. Submucosa. 3. Fibrocartilaginous layer. Main bronchus has cartilage rings. Other bronchi have cartilage plates. Smallest bronchi do not have cartilage. 4. Adventitia. 2. Clara cells, found in distal sections, produce enzymes that break down surfactant. Alveolar tree and gas exchange. 1. Airflow. Bronchi right-pointing arrow terminal bronchioles right-pointing arrow alveolar tree, contains both conducting and respiratory components. 2. Acini. Functional units of the lungs. Formed by terminal bronchioles, which branch into 14-16 primary respiratory bronchioles. These divide into secondary and tertiary respiratory bronchioles. Tertiary bronchioles further divide into alveolar ducts. Each alveolar duct ends in 2 alveolar sacs, which contain alveoli. Each alveolar duct has approximately 20 alveoli. Structure of acinus. 1. Respiratory bronchioles contain cilia. Clara cells. 2. Gas exchange occurs through alveolocytes, cells covering alveoli. Microvilli are present in alveolocytes. Alveolocytes produce surfactant. Surfactant. 1. Composition. Proteoglycolipids. 2. Functions. 1. Maintains surface tension inside alveoli. 2. Prevents alveolar collapse during exhalation. 3. Has antibacterial properties and prevents infections. Blood-air barrier. 1. Formed by thin respiratory alveolocytes and capillary basement membranes. 2. Capillaries surround alveoli in thick networks. Additional functions of the lungs. 1. Gas exchange. 2. Acid-base balance regulation. 3. Immunoglobulin production by plasma cells. 4. Immunoglobulin excretion into the respiratory lumen.